Hi, I'm Shanna and this is Rachel. Today we are going to demonstrate the SFMA. According to theory, the SFMA should be used as a general screen on all patients. So for starting out, Rachel, I'm going to have you bend your head all the way down. Okay, so before, what we're going to be looking for is dysfunctional movement patterns with pain, functional patterns, and functional with pain. So before we start, again, let me know if there's any pain with any of the movements you do, okay? So is there any pain with that?
No.
So that would be the cervical flexion, and that looked like that was functional because she could bring her chin to her sternum and there was no pain with that. So the next, what we're going to do, I'm going to have you bring your head all the way back so you're parallel with the ceiling on your forehead. It looks like her forehead is parallel with the ceiling. Was there any pain with that? So she would be functional for cervical extension. The next one we're going to do is cervical rotation. So I'm just going to have you rotate your head to the right and the left. Any pain with that?
Nope.
So this would be functional because her chin is in line with her clavicle. And now let me see, go to the right. This actually would be dysfunctional because her chin is not in the midline of her clavicle. Was there any pain with that? So the next assessment part is upper extremity pattern 1. So what I'm going to have you do is I'm just going to have you bring your right arm and touch your opposite shoulder blade on the inferior angle. So it looks like she can touch the end of the bottom of her scapula. So I would say that you're functional. Can we see you do it on the other side? Same thing, she can touch, she looks like it's not painful, you're moving in a fluid way. So that would be both functional. The next one is the upper extremity pattern 2. And this one, you're just gonna bring your hand behind your head and touch the top of your other shoulder blade. Okay, that looks easy for you. Can I see the other side? So those were both functional. It looks like you reach the spine of your scapula, and those are both functional. The next one we're going to do is the multi-segmental flexion. So this one, if I can have you just face me, you're going to have your toes together, and you're just going to bend forward and touch your toes. So since Rachel can touch her toes, this is functional. Do you have any pain with that?
No.
And it looks like she has a nice curve in her spine, and it looks like her sacral angle is over 70 degrees. You can come back up, Rachel. So the next one we're going to do is the multi-segment extension. So I'm just going to have you raise your arms up, and I'm just going to have you lean back. So right here, if you can see that this curve in her spine is not uniform, and it looks like her ASISs are not going over her toes, which is one of the criteria to be functional. And so I'd have to say you're dysfunctional on that. And the next one is I'm going to have, it's called multi-segmental rotation. So with this one, I'm just going to have you stand and face the wall. And I'm just going to come over here and I'm just going to ask you to turn your waist and look behind you. So you can look at me over here. Okay. And so it actually looks like you are functional on that side. Now look this way. Good. So it looks like your shoulder rotation are over 50 degrees and your pelvis rotation was about over 50 degrees. And you didn't have any excessive knee flexion or extension, so you're functional with that rotation. And so the next one is going to be a single leg stance. So I'm going to just have you start with your feet close together, hands on your hips. And we're going to do this with eyes open, eyes closed. And I'm actually going to time you 10 seconds each. And so let me get my handy dandy timer. All right, so we're going to start with the right leg. Go, eyes open. And here we're just making sure her hips are level and she's able to maintain the stance. Good, that was 10 seconds. Now we're going to try the other leg. Go. Good, that was 10 seconds. So now we're going to try one leg again, and we're going to have our eyes closed this time. Okay, you ready? Go. but you had it. All right, so now the other leg. And that was 10 seconds. So I'd say she was functional in that because she was able to keep right. Even though she had a little bit of wobbling, it wasn't enough to say that she was dysfunctional. And the last one is the overhead deep squat. So this one, you're going to have your arms straight over your head, and I'm just going to have you go into a deep squat, as deep as you can. Okay, so that actually was dysfunctional because your arms actually were displaced when you were squatting and your knees went over your toes. So that would be marked as dysfunctional. Do you have any pain with any of that?